Question 1. The nurse is getting ready to do an admission assessment on a patient who was recently diagnosed with bulimia nervosa. Which assessment finding would the nurse expect to see? Select all that apply. Number 1, tooth decay. Number 2, oily skin. Number 3, loss of tooth enamel. Number 4, electrolyte imbalances. Number 5, thin appearing, no fat on them. The answers are 1, 3, and 4. That's tooth decay, loss of tooth enamel, and electrolyte imbalances. The rationale for that is that patients with bulimia nervosa do not appear to be sick or thin. They usually are average looking. However, when you do further assessment, you can see that they have tooth decay and loss of tooth enamel and electrolyte imbalances from the vomiting. Also, their skin is dry, not oily. Question 2. Which of these patients must the nurse be careful with when giving acetaminophen Tylenol to? Number 1, patient with hepatitis B. Number 2, a patient who randomly drinks alcohol. Number 3, a patient who is allergic to aspirin. And number 4, a patient with GI issues. Answer is 1, hepatitis B. Acetaminophen Tylenol can cause liver damage. A patient with liver diseases such as hepatitis B should not be given it. Heavy alcohol consumption could damage the liver also, but this patient only drinks random drinks. Being allergic to aspirin should not affect their Tylenol intake. Lastly, Tylenol does not cause GI problems, unlike NSAIDs. Question 3. A mother just found out her son was in a car crash and comes running into the emergency department asking how her son is feeling. Which response is appropriate for the nurse to give? Number 1, your son is awake and talking. The doctors are seeing him now. When they are done, you could go see him. Number 2, don't worry, our doctors are amazing. I'm sure he's fine. Number 3, please calm down. Everything is okay. Number 4, your son is young. He'll be fine. Answer is 1. Your son is awake and talking. The doctors are seeing him now. When they are done, you can go see him. The rationale for this is that this mother is very anxious and nervous. You can't just shut down her feelings on one hand, but on the other hand, you can't give her false reassurance. Therefore, what you're supposed to do is tell her that he's awake and talking so she has peace of mind, and then later you could fill her in with the rest. Question 4. A baby has meningitis. Which isolation precautions must be maintained? Number 1, contact precautions. Number 2, neutropenic precautions. Number 3, none because antibiotics were started. And number 4, isolation precautions for at least 24 hours post starting antibiotics. Answer is 4. Meningitis is droplet. Isolations must be kept for 24 hours after starting antibiotics. Question number 5. A first-time mom asks when she could place the car seat face-forward position. What is the best response for the nurse to answer? Number 1, as long as there are safety locks. Number 2, over 50 pounds. Number 3, when the child is age 1 and over 20 pounds. And number 4, when the child outgrows the car seat. Answer is 3, age 1 and over 20 pounds. It really goes according to the manufacturer. However, generally it's when the child is 1 year old and weighs over 20 pounds. Question 6. Which of these patients have an abnormal vital sign change? Select all that apply. Number 1, a blood pressure that's 120/80 when sitting and 140/60 when standing. Number 2, 98.2 Fahrenheit rectal temperature in the morning and 99.4 in the night. Number 3, a heart rate that was 84 before eating and after eating was 65. Number 4, a respiratory rate that was 16 when sitting and then after walking was 24. Answer is number 1 and 3. Number 1 was a blood pressure that was 120/80 while sitting and 140/60 while standing. And number 3 was a heart rate that was 84 before eating and after eating was 65. The rationale for this is a change more than 10 can be postural hypotension and is abnormal. Heart rate is also abnormal as a slightly increase may occur after eating, not decrease. Temperatures are normal as they could increase during the day, and the respiratory rate is normal for it to increase after exercise. Question number 7. Which antibodies are passed on through breastfeeding? Number 1, IgA, number 2, IgE, number 3, IgG, and number 4, IgM. Answer is 3, IgG. The rationale for this is the antibody IgG is passed to the child through the mother's breast milk during breastfeeding. IgA, IgE, and IgM are produced by the child's body after exposure to an antigen. Question 8. A patient with osteogenic sarcoma is scheduled for an above-knee amputation. Which of the following responses from the patient indicates that they need further teaching? Number 1, I wish I didn't have to have chemotherapy after the surgery. Number 2, I will finally be cured from cancer after the surgery. Number 3, physical therapy will help me after the surgery. And number 4, I'll be in serious pain after the surgery and will need a PCA pump. Answer is B. I will finally be cured from cancer after that surgery. Osteogenic sarcoma is a destructive cancer that metastasizes early. Surgery by itself cannot cure it. Chemotherapy will be required after the surgery. Question number 9. The patient has osteoporosis. Which meal is high in calcium that you would recommend? Number 1, cheese sticks, omelets, and grapefruit. Number 2, a whole wheat ham sandwich, broccoli, and apple. Number 3, chicken breast and brown rice. Number 4, whole wheat sandwich with sardines, yogurt, and whole milk. Answer is D, whole wheat sandwich with sardines, yogurt, and whole milk. The rationale for this is sardines, yogurt, and milk all have high calcium content. The other choices have food in them that have low calcium content like eggs, grapefruit, and apples. Question number 10. Why should a pregnant woman lie on the left side when sleeping during the last trimester? Number 1, to help break down the food. Number 2, to not compress the vena cava. Number 3, to not compress the bladder. And number 4, to prevent birth defects. Answer is 2, to not compress the vena cava. If one lies on their back, the weight of the uterus could compress the vena cava. This could stop blood flow to the uterus. Therefore, it is recommended to lie on the side. Thank you for watching. Please subscribe and stay tuned for more. So don't forget to click on the link above to see the NCLEX review.